A penetration depth of irrigants into root dentin after sonic, ultrasonic, and photoacoustic activation. Paper published by Galler et al. From University Hospital Rosenberg in Germany. In the introduction, the author justifies his research with the fact that with the mechanical preparation alone, more than one-third of the canal surface may remain untouched by the endodontic instruments, according to Peters et al. 2001 and Peck et al. 2010, resulting in insufficient debridement. And recently, irrigation activation techniques have been developed, like passive ultrasonic irrigation, which induced acoustic microstreaming of more than 25 kHz, and sonic devices that work similarly but generally use flexible tips and operate at lower frequencies, less than 20 kHz. And more recently, laser-activated irrigation based on the activation of irrigants by lasers has gained increasing attention in endodontics. He mentioned the mechanism of the effect of laser in irrigation activation, which is achieved by inducing vapor bubbles at the fiber tip. These bubbles result in acoustic streaming of the solution throughout the entire canal system. An example of the laser-induced activation is the PIPs, photon-induced photoacoustic streaming, and the shockwave enhanced emission photoacoustic streaming, which differs from the PIPs in which that pulses create a secondary bubbles leads to collapse of an existing bubbles, resulting in shock waves and enhanced photoacoustic streaming. The aim of the study was to assess whether newly developed methods of activation are more effective than commonly used techniques, and to compare their ability in to enhanced irrigation penetration into dentinal tubules. A 90 single-rooted human teeth extracted from for orthodontic reasons were instrumented up to size 40 O6 taper. The protocol for final irrigation was established as follows: sodium hypochlorite for 1 minute, then ultra pure water for 1 minute, then EDTA for 1 minute, then activation for 30 seconds, and then ultra pure water for 1 minute, and sodium hypochlorite for 1 minute, and activation for 30 seconds. The teeth were randomly divided into 5 test groups and 1 control group where the activation was performed as follows: 1. Manual dynamic activation using needle irrigation with manual up and down movement of the needle inside the canal. Group 2. Passive ultrasonic irrigation. Group 3. Sonic activation. Group 4. PIPs. Group 5. Shockwave enhanced emission photoacoustic streaming technique. The control group, final irrigation only with 1 ml of 5% sodium hypochlorite without activation. The penetration depth of methylene blue into the dentinal tubules were a surrogate measure for the penetration of sodium hypochlorite during the last step of activation. Cross sections of the roots collected from the coronal, middle, and apical thirds. The penetration depth of methylene blue dye was determined visually by 2 examiners, and the median penetration depth was calculated. Also, the median penetration depth, as well as 25 to 75% quantiles were calculated and depicted for the entire canal and separately for coronal, middle, and apical regions. The minimum penetration depth was determined in each section, and median values as well as quantiles of these values from all sections were calculated. The results, the median penetration depth for whole canals from highest to the lowest were sonic activation, then PIPs, then passive ultrasonic irrigation, then manual dynamic activation, then shockwave enhanced emission technique, with significantly lower penetration depth for the shockwave enhanced emission technique compared to PIPs. The minimally achievable penetration depth was greatest for PIPs, with significant differences compared to sonic activation, manual dynamic activation, and shockwave enhanced emission technique. The separate evaluation of median penetration depth in the coronal, middle, and apical regions. The coronal and middle sections, the various activation methods achieved similar results. However, differences became apparent apically. The greatest median penetration depth were observed for PIPs, coronally, and apically. PIPs, the photon-induced photoacoustic streaming, was associated with significantly deeper penetration in the apical sections compared to needle irrigation, and also to shockwave enhanced emission technique. Considering the minimally achievable penetration depth, PIPs achieved the greatest penetration depth in the middle and particularly in the apical sections, with significant differences compared to all other groups. In conclusion, activation of irrigants increased penetration depth apically, and PIPs was associated with segments of deeper penetration, followed by sonic activation and passive ultrasonic irrigation. The shockwave enhanced emission photoacoustic streaming did not show benefits compared even to manual dynamic activation. Thank you.